Statins are a very commonly prescribed preventative group of drugs that inhibit the production of cholesterol in the liver. Statins are commonly prescribed to patients suffering from hypercholesterolemia or patients suffering from increased risk of heart disease due to atherosclerosis. Statins are most commonly prescribed medication in the US, with approximately 25 million patients being prescribed lipitor every year. The widespread use of statins as a landmark medication has arguably increased the lifespan of our ever-indulgent lifestyles, but it has also brought on many criticisms on statin therapy's efficacies and widespread usage as a preventative medicine. We will be examining why statins are so commonly prescribed by analyzing their biochemical and metabolic method of action. It is important to note that the exact biochemical and physiological processes that govern the creation and destabilization of atherosclerotic plaques have not been completely elucidated. However, increased blood concentrations, in particular LDL concentrations, have been implicated in the development of atherosclerosis. The study of atherosclerosis plaques primarily began with the study of patients suffering from familial hypercholesterolemia. Patients suffering from congenital hypercholesterolemia have highly elevated blood cholesterol levels and show early onset symptoms of atherosclerotic coronary disease. Atherosclerotic plaques would eventually enlarge, reducing blood supply or even a rupture, resulting in premature death from ischemic heart attacks or strokes. This disease progression is also seen to a slower extent in typical individuals and tends to increase dramatically with age. The creation of atherosclerotic plaques begins with the oxidation of LDL apolipoproteins by oxygen radicals and metalloproteases. LDL and HDL lipoproteins are used to traffic and deliver lipid-soluble cholesterol molecules via blood, which is water-soluble and incompatible with purely lipid-based molecules such as cholesterol and fatty acids. The oxidized lipid particles are unable to leave the tunica intima of the vasculature. Excess oxidized LDL elicits an inflammatory response by interacting with TLR and LOX receptors. This encourages macrophage migration and extravasation into tissues. The macrophages then uptake the oxidized LDL proteins and transform into so-called foam cells. The foam cells are unable to properly digest the oxidized LDL and must transport the cholesterol back into the bloodstream via scavenger receptors such as ABCA1, which interact with HDL or risk dying. Inhibiting cholesterol synthesis with statins reduces the symptoms of atherosclerosis by putting cells in a cholesterol-deficient state. Cells will attempt to compensate for its deficiency by increasing the expression of LDL receptors or increasing the expression of HDL to pick up excess cholesterol and fat from tissues. The synthesis of cholesterol is highly complicated and involves many steps, which will not be discussed for brevity. The synthesis of cholesterol begins with the synthesis of acetoacetyl-CoA from two molecules of acetyl-CoA via an enzyme called thiolase. Acetoacetyl-CoA is then combined with another molecule of acetyl-CoA to form HMG-CoA. HMG-CoA is then reduced to form mevalonic acid by an enzyme called HMG-CoA reductase. HMG-CoA reductase is the principal rate-determining step of the pathway and commits mevalonic acid to cholesterol synthesis and its byproducts. Statins induce their effects by competitively binding to the active site of HMG-CoA reductase. The subsequent reduction in intracellular cholesterol activates cholesterol-sensitive proteases in the endoplasmic reticulum that cleave sterol regulatory element binding proteins. These proteins migrate to the nucleus and bind to sterol response elements responsible for regulating lipid synthesis and uptake. Statins also possess many anti-inflammatory properties that aid in modulating plaque formation and could even be beneficial in treating inflammatory neurological disorders such as MS and autoimmune encephalomyelitis, which currently don't have many low-risk pharmaceutical treatments. Research conducted in 2002 on transgenic lab mice showed significantly reduced relapses in mice after being given 1 to 10 mg per kilogram doses of lipitor. These effects were, as the study indicates, most likely due to suppression of T-cell proliferation and promotion of the Th2 immune responses. A reduction in protein prenylation, metalloproteinase expression, and inflammatory cytokine signaling also probably aided in the observed results. Current other active areas of research mainly focus on reducing the known side effects of statins such as sexual dysfunction, pancreatitis, pancreatic cancer, rhabdomyolysis, digestive dysfunction, and fatigue by coupling statin treatment to more targeted approaches that increase NDL and cholesterol excretion without disrupting other metabolic pathways dependent on cholesterol. In conclusion, statins play a crucial role in preventing the formation and progression of atherosclerotic plaques, which are a leading cause of major ischemic coronary events like heart attacks and ischemic strokes. By reducing blood cholesterol concentrations and stabilizing plaques, statins effectively reduce the risk of yearly cardiovascular complications by up to 25% for each millimole reduction in blood LDL. However, it is important to note that the efficacy of statins is influenced by the patient's lifestyle and adherence to treatment. Making healthy lifestyle choices and regular medication is essential for optimal results.